Hey everyone, thanks for joining us today. We are really excited to be back with our third annual One Country Rural Progress Summit. And this is a labor of love for those of us who care about rural policy and about what's happening to kind of help develop and bring rural America kind of forward and foremost in people's thoughts. Over the next 3 days, we're going to hear from elected leaders, industry insiders, and policy experts addressing some of the key economic issues facing rural America. Political analysts and campaign veterans will give us some insight into shaping how we should think about our elections in rural America and what we can expect in 2024. We're also going to hear stories from people on the ground in rural America making a difference in their communities every day. And quite honestly, for me, those portions of this program give me great hope. There's not a lack of kind of intellectual thinking about what needs to happen, but there's a lot of implementation out there and adaptation out there that is just so important. Today, in this first day, we're going to focus pretty heavily on rural family policy, because we're going to discuss paid family and medical leave policies in our states and in rural America, and in what's happening to kind of bring those policies to the forefront in Washington, D.C. We're going to hear about childcare. Yes, everybody is concerned about childcare, but nowhere is the need more acute and the challenge more daunting than, I think, rural America. Our first featured conversation of the afternoon will focus on a new documentary, If Dreams Were Lightning. You might recall that from a song. One of my favorite songwriters, John Prine, had a great song, If Dreams Were Lightning and Lightning Was Desire. But this is about the rural healthcare crisis. And I think we're going to see this very short documentary, and it's going to be followed up by a panel discussion focusing on how we can deliver better outcomes to rural America. And we'll close the day with our second featured conversation, which is the founders of the Lakota Code Camp, who are teaching Indigenous youth coding languages and preserving at the same time Indigenous languages using artificial intelligence. A note to our audience, between sessions, you will be returned to the lobby area and you can select the next scheduled program if you want to participate. You can also visit the virtual expo floor to learn more about our sponsors and partners who help make this summit possible. Now I want to turn this program over to my friend and fellow One Country board member, J.D. Scholten. He is currently representing the 1st District in the Iowa House. It's based in Sioux City, Iowa, and he is the lone Democrat in Western Iowa, and has always described his district as a blueberry floating in a bowl of tomato soup. JD is going to have a great panel discussion on paid family leave policies in states around the country. JD, welcome to the Rural Progress Summit. You take it away from here.
Sounds great. Thank you, Heidi. 1 minute in and we're already referencing John Prine, so I feel like I'm in the right place. It's great to be here at the 3rd annual Rural Progress Summit. For paid family and medical leave has been a growing political issue and policy issue across this country for the last few years. Even before the pandemic brought extraordinary challenges, caregiving has been a growing stress in the lives of American families. Now, as many Americans are in the twin role of caregiver to aging parents and parenting their own children, commonly referred to as the sandwich generation, many have been forced to leave the workforce and jump between jobs in order to manage these multiple roles. This is hard on families, disruptive to businesses, and a drag on the economy. This is especially true in rural communities where caregiving often involves significant travel. Fortunately, there has been many recent progress both nationally and in states to provide a better paid family and medical leave structure. And we have a terrific panel here to discuss this. First, we have the Honorable Jennifer Williamson, a partner with Swift Public Affairs and a former majority leader in the Oregon State House, where she passed the state's paid family and medical leave law. Next, we have Molly West Williamson, a senior fellow with the Center for American Progress, CAP, And prior to joining CAP, Molly served in the inaugural member of the board of directors of the Connecticut Paid Family and Medical Leave Insurance Authority. And finally, I'd like to introduce Josh McCabe, Director of Social Policy at the Niskanen, I probably mispronounced that, Center. Josh has published multiple studies on paid family and medical leave policy with the emphasis on state level programs. So Jennifer, Molly, Josh, welcome to the Rural Progress Summit. And just before we get to the panel, I do want to have a quick reminder to viewers. You can submit your questions through the Q&A button, not the chat, the Q&A button, and we look forward to answering them. So with that, I would first like to address Jennifer. We'll start with you. When you served in the State House, you were a key leader in the passage of Oregon's paid family leave program. Could you tell us a little bit about that experience in Oregon and what lessons you learned that other states could benefit from?
Sure. Thank you, JD, and everyone for having me here. This is exciting. One of my proudest moments in the Oregon legislature was passing our paid family medical leave bill. It was a long time coming. I will say that we, the Oregon Democrats of my era, now I left at the very end of 2019, so it's starting to feel like a little while ago. We actually had a whole economic plan that we worked on for years, almost 10 years, that included raising the minimum wage, paid sick leave, also childcare. And I continue to do work on childcare and universal childcare for the state of Oregon now in my post-elected career. So we recognize that all Oregonians, rural, urban, suburban, need these kinds of economic supports to be successful, but particularly in rural Oregon. And I, JD, a little bit like you, in the legislature, I represented downtown Portland, but I grew up on a farm. I still, my family still has a farm. All of my family members are farmers. So I was the odd duck in a bowl of blueberries, but came from a family of blueberry growers. So it all comes a little bit full circle in working on these policies. So I think there are a couple of things we learned in Oregon. First of all, this is an incredibly technical area. I'm glad Molly is on. We decided we're not related, but maybe we are. We both care about very similar things and have very similar values. So this was incredibly technical. We had a bipartisan set of legislators working on this, which I can tell you as the Democratic majority leader at the time was often very frustrating, but incredibly important. And we had to get in the weeds. We spent years in policy land trying to hammer out all of the technicalities of these policies to make sure that they actually worked for people on the ground. And there were 4 values that I came to the table with that no matter what the negotiations were, they weren't going anywhere. And the first was this needed to apply to all workers, regardless of size of employer, because often that's used as a way to say, it's better for business if we only have big employers, whatever. Rural Oregon and rural America is full of small employers. So if you exempt employers by employer size, you are exempting rural America. And so you have to make sure that no matter where people work, their employer size is covered. And one of the things we did in Oregon is if your employer has an equal or better paid family medical leave policy, then they are opted out of the state program. So there's a way in which employers can do better than the state program. And what we didn't want to do was incentivize employers to get rid of their programs, especially if they were better than the state one. So we incentivized employers to stay in their own programs if they wanted to, but everybody had to be in. We also made sure that no industry was exempted, including agriculture, because if you exempt any industry, folks are going to want to exempt agriculture. They do it in minimum wage conversations and, all of those things, paid sick leave, all of that. We had a battle over whether or not particularly agricultural workers were exempted. And that was an absolute no-go for me as the primary sponsor of this bill, that everybody was in. Again, no matter what the employer size, no matter what you did for a job, you were in. We wanted to make sure, too, that we had the most progressive wage replacement in the state, because what I didn't want to do was incentivize high income earners to take paid family medical leave and make a program where it was impossible for low wage earners to take it because they couldn't afford to take it. So we wanted to make sure that people actually could afford to take the program or take the leave that they needed to take care of their families by having their wages replaced up to 100%, so that nobody had to decide whether or not they could afford to take the leave. And finally, intermittent leave. Often, as you mentioned, in rural America, healthcare is hard to get. And so you may have, you may be traveling for doctor's appointments or a surgery that's far away, and then you can come back and recover and take care of someone, but then they have to go away again. And so the ability to kind of mix and match your leave based on your need, as opposed to taking care of, having big chunks or having a really restrictive policy where it's not flexible enough for what you need. And finally, Oregon is the first state to have employers and employees pay in, because that was the other thing, is that we didn't want it to be 100% employee paid. That just was, unacceptable. And so those were our bottom lines. And, on the other end of it, I think the lessons that we're learning now is we will always be tweaking this program. Like a lot of good programs, there are lots of things you can't predict, lots of economic issues that you can't predict. And so, one of the first things we learned is that people were logging on and pretending to be other people and getting their leave out of the gate. And so people would log on because they were getting ready to have their baby, and suddenly they found out they already had an account and somebody had logged in and created an account in their name. And so we had to do a big push around fraud very first thing when the program came online. So there's lots to learn after the program, that the Oregon State program started, but we are at the table in every session that the legislature's been in ever since we've been working on this. And I suspect we will continue to work on this program until I am no longer doing this. And that's okay, because it's important, and it's important to get it right. And it's important that it's flexible, and it's important that it works for folks. So like I said at the beginning, I'm really proud of this program. And I know for a fact that my sister had surgery yesterday, and she is on paid leave. And so is her husband, who's taking care of her. So it makes a huge, and they live in rural Oregon, so it makes a huge difference on the ground to families. So I'm so happy we're having this conversation and that I can be a part of it. Thank you.
Yeah, thank you. Molly, since you have the best sign behind you, I'll start with you on this next question. 13 states now provide access to paid family and medical leave to employees as a guaranteed right. Some of those states, like Maine and Minnesota, offer guaranteed unpaid leave, while other states ensure at least some sort of payment component to their programs. How have those states' programs been working so far? And do you see these programs as model for the rest of the country to follow, or do you think something else? And Josh, I'll follow up with you after this.
Sure. Thank you so much to everyone for this amazing event. So as you mentioned, there are 9 states, including Oregon, that are already paying out paid leave benefits, along with the District of Columbia. We've got 4 more coming online in the next couple of years. And when we put these states together, what we really got is a track record. So next month, we'll celebrate 20 years of paid family leave benefits in California, which is the first in the nation program. But that's barely scratching the surface. We've been paying paid medical leave benefits in states like California, New Jersey, New York, Rhode Island for over 80 years at this point. So we know what works. We know how to keep tweaking it and keep refining it, which we're continuing to do everywhere. But we know that when we set them up right, when we set up insurance systems where employers or employees or a combination of both are paying in, that we can create paid leave benefits that are going to work for workers and work for their families, that are going to work for employers, that are going to work for the economy as a whole. And when we do it in this way, we can do this in a way that's sustainable, that's affordable, that's universal, and that really gives us a lot of evidence to build from on how we keep improving in the places that we already have paid leave, but also how to build new programs. There's many more states that are continuing to work to add it. And in the long run, how do we build towards a truly universal paid leave for all program at the national level?
When you said 4 more are coming on board, is Iowa in there by chance?
So there's 4 states that have already passed laws that have benefits coming soon. So Maine, Minnesota, Delaware, and Maryland are all starting benefits in the next couple of years. But we're always looking for who wants to be the next state in line. So if Iowa would like to get in the queue, we'd love to help you do it.
I'll see what I can do. Josh, do you want to follow up with anything when it comes to what we're seeing across the nation and what programs are working?
Yeah, I think the important thing, and everyone touched upon this, is the way we've set up these programs follow this track record of being a contributory social insurance program. So they're funded by very broad-based payroll taxes on employers and employees. They're set as a replacement rate of your previous wages. And they so far have all been relatively comprehensive. We've seen, as Molly mentioned, in some cases, states start with a narrower set. But I think that the key goal is you want to get to comprehensive as quickly as possible.
Okay, so we have two states I would like to talk about, New Hampshire and Vermont. They've also provided a paid family and medical leave program, but it is structured as an insurance offering that employees must pay into. Some other states, primarily in the South, have considered adopting this model of PFML. What are some of the shortcomings to structuring a paid family program as insurance policy? Okay,
so I think the way to think about the difference between what a state like Oregon or Maine or Minnesota has done and what New Hampshire has done, Vermont's following in their footsteps, is the difference between a guarantee and a gamble. So states like Oregon have guaranteed workers, here's this benefit that you're entitled to. It's going to stay with you if you move from job to job. You know, it's going to be there regardless of employer size or industry. But what New Hampshire has done and Vermont is a little not as far along in their timeline, but taking the same approach, is they've contracted with an insurance company and said employers who want to can voluntarily choose to buy into this program. And there's some options for individual employees. And the problem with that approach is a lot of employers won't do it. And so, in fact, what we know in New Hampshire is we've had 2 full enrollment cycles. Only about 2% of private sector employees in New Hampshire are covered in their program. And that may be really beneficial to that 2%, but for the 98% who are not getting benefits through that program, an awful lot of whom are not getting benefits at all, that's a huge gap. And it's really not succeeding in moving us in the direction that we want to of a guaranteed benefit people can rely on. It's really just a fancy new coat of paint on the old-fashioned boss lottery. We're also seeing other states so Virginia was the first, that passed laws that basically just say insurance companies that want to can sell paid family leave insurance. That's not a bad thing. That may be helpful to folks whose employers choose to purchase it. But we know that's not going to get us to universal coverage. We know that's not going to get us to everybody. And so while it's always good to be moving in the direction of more leave for more people and helping folks have options, if we want to have true universal coverage that's going to get to folks in rural areas, it's going to get to folks at small employers, it's going to get to part-time and low-wage workers, the only way to do it is to keep building on what we know works, which was a guaranteed system people can rely on, the same way we rely on a universal system like Social Security.
Well, I will say, to add to that, Molly is exactly right, JD. One of the issues that we saw and I saw as a legislator is the insurance lobby loves the idea of another insurance product to sell. So that, they came in hot and heavy on this issue. And I like to remind my colleagues, how well is our insurance system working for healthcare through employers, right? I mean, it's based totally, as Molly said, it's your, what did you call it? The boss lottery, which is a fantastic term. That, if this isn't portable, you end up stuck in jobs because you can get the leave you need in one job and not another. So, people should just really hold on to their love of the American health insurance system when they're thinking about making policy around private insurance. Private insurance would cover the people who can afford private insurance. And especially in rural America, those are the folks who can't afford additional insurance policies. And as a small business owner myself, the idea of going and buying, regardless of where my heart is, buying an additional policy is something that for small businesses is really difficult. And so it's not just it's better for the employee, it's also better for small employers to have it covered in a way where they're not carrying the whole burden because they may want to do right by their employees and they just can't afford it. And people they think about employers as monoliths, especially when you're talking about rural well, actually, any part of our economy, not just our rural economy, but small business, family-owned businesses. It's difficult to carry that burden as an overhead cost when the program can be better, more efficient, and cover more folks as a guarantee and not as a gamble.
So far we've talked a lot about programs that cover workers based on contributory programs with benefits paid through withholding from paychecks. Josh, what are some strategies for covering other workers who need access to PFML but do not qualify under existing programs?
Yeah, so I think it's a really important question. So even with a well-functioning contributory program, there's going to be some subset of new parents, for example, who won't be eligible because these programs typically have some work history requirements that they're not able to meet for one reason or another. I know in Massachusetts, I was fresh out of grad school, wasn't eligible for the program for that reason. So there's some complementary programs that other countries, other states have thought about to make sure we make this program truly universal. So anyone who has a new parent, anyone who needs some time off, has access to some program to give them financial security while they take care of their family or themselves. So the first one is at-home infant care programs, which are income-tested programs that provide new parents with financial support to stay at home with their children for the first 12 weeks. So states can do these now. Minnesota, Montana, and I believe New Mexico have them on the books, but they tend to be really hard to fund. So if we want to see that work a little better, we might want to think about federal support for such programs. The second one is this broad idea of, in Australia, they call it a baby bonus. And if you're not eligible for their primary program there, you get this baby bonus where it's just a tax credit or a set of cash in the weeks that following the birth of a child that you don't have to stay home, but it allows parents to stay home. We've seen several bills in Congress. Representative DeLauro, Senator Daines have similar bills that would provide some sort of tax credit to new parents. And I think the last one is family caregiver support programs through Medicaid. In some ways can provide financial support for family members to take care of elderly and disabled family members. But these are all relatively small new programs that need to be expanded in the future.
And I think that leads into our first Q&A question pretty decently. So what are the possibilities of having a national policy taking into account the lack of effectiveness with the current attitudes in Congress? I mean, we're seeing this in all sorts of different issues where it's state by state. And like I literally border South Dakota and Nebraska. And so workers here can, like we have three choices and they could be three completely different. Unfortunately, they're not, but what are, anybody want to talk about the federal potential? Molly, do you want to start?
Sure, I'm happy to. So the first answer is it's a question of when, not if. We have been working to pass comprehensive paid leave in this country for a very long time. We have been building towards the victory of unpaid leave in the FMLA is now 30 years old. We actually came very close to having paid medical leave in the Social Security Act in 1935. So this is not a new problem. We're just working towards smarter solutions. And I think I want to really think about two things when it comes to this. The first is just the overwhelming majority of Americans of any political affiliation support paid leave. And they support paid leave even if you ask them to pay for it. Every poll will tell you strong majorities of Republicans, strong majorities of Democrats, strong majorities of independent, every gender, every age support paid leave. It is an idea whose time has come and people are ready to support. The other thing to think about here is in 2021, comprehensive permanent paid leave that would have covered essentially all workers in the United States for their own serious health needs, to care for a broad range of family members, to welcome a new child, passed the House of Representatives. This is not a crazy idea that we're just talking about in Zoom somewhere. This is an idea that Congress has understood, that working people understand, that legislators around the country understand, and that we're really working towards how do we build from. Now we have decades and decades of state data. We've got really great laboratories that tell us, here's what works, here's, as my co-panelist mentioned, here's where we need to improve. Here's how we need to make sure that this program benefits all workers. But the question is really, how do we get this over the finish line? And I think when I say the finish line, sometimes we talk about that as, when you get the bill signed and you have the big party and you celebrate it. But that's really halftime. The finish line is the worker who's at home taking the leave. It's when you get the surgery that can save your life and you get to recover. It's when you get to be there when your child is born. It's when you get to be there to hold your parents' hand as they pass. And I think that we are really at a moment where we are seeing an unprecedented level of attention, an unprecedented level of priority. And it's really just a question of how do we keep building from that momentum and building from what we know works to really deliver that for all people, because that kind of national guarantee is what working families deserve.
JD, if I can just emphasize 2 points that Molly made. The first is, I don't even know, Molly, that it's halftime when the bill passes, frankly, because there's a lot of work to do in implementation, and paying attention to implementation and it going well, I think, is a lesson we learned in Oregon, just staying on top of it. And often, we pass bills and we celebrate, and then off we go as elected officials. And for anybody listening, stay on top of the implementation. And I think, especially if we do this when we do this at the national level, really monitoring implementation and making sure that it works is so key to this going well. Second, the polling. We had a bipartisan group of legislators who wanted this, and the reason was the polling. And I can't emphasize it enough. Americans want this, and their elected officials need to understand that they want it. And often their elected officials don't understand that they want it and that they are willing to pay for it, that this is incredibly important to stabilizing families, employers, the whole 9 yards. So I'm glad you brought that up, Molly, because that is a key takeaway, I think, is we cannot talk enough about how popular these programs are. And for anybody who's out, beating on doors, showing up at town halls, being a good engaged community member, reminding their elected officials that these programs are needed and that they serve their communities well, and that people of all political stripes want them. I just, beat that drum when you're out in the community, because often elected officials have to be educated on it or reminded how important and popular these programs are, no matter where you live.
Well, Ed, I'm optimistic on the federal level. We know historically with unpaid leave, it started as more of a partisan issue, Democratic led, became bipartisan. Right. We made a bit of progress, and I think we're seeing that now with paid leave on the federal level, where it started with a Democratic led coalition, and we've seen what was the House bipartisan paid family leave working group is now the bicameral bipartisan paid family leave working group. So we're slowly seeing interest grow over time. So as Molly said, it's not a matter of if, it's when, and just sort of what that's going to look like and how to make everyone in that room happy to get to yes.
I've worn many hats in my life, and one of them I used to play professional baseball, and I played overseas and in Europe. And 1 year I was in Belgium, and one of my teammates had a newborn, and he had a whole year off, paid, and I look at the U.S. and the average, I think, cost of having a child is over 10 grand. Even though we're the wealthiest country in the world, and health insurance and all that stuff, we think that's a whole different debate that I think we'll be talking about later. But could we? Is there where internationally are some of the best paid leaves, and what do you think makes it good there? And could we take parts of it? Could we take all of it? What I saw it work so well firsthand, and just prioritizing family life.
Yeah, I think, JD, that is the point, right? It's whether or not you prioritize family, and whether or not you prioritize supporting the structure of the family, and that it's not just lip service, but it's actual policy. So, I am not an expert on policy programs around the world. I did have my ex-husband and I went to Europe for a couple of months so that he could cover for a coworker who was out on family leave for a year. And he got to be with his brand new baby for a year. So, it was a pretty cool experience for everybody. But the reality is that the government in that country and in Belgium support families. So whether it's, wages or healthcare or childcare or paid family medical leave, it's a whole bundle of policies that make it possible for families to thrive. And I think that that's the real, we can have the conversation here about paid family medical leave and about health insurance in another Zoom. And, we end up siloing these conversations. And I think the bottom line is, do our policies support families? And do they support families thriving from, cradle to grave? Frankly, and how do we do that, and how do we make that a nonpartisan issue? That it is not about the letter behind your name as an elected official or as a voter. It's about whether or not you want families to thrive in your community, urban, rural, suburban. And I think this is just one example of we're creating a patchwork around the states of these policies. But the bottom line is the value is the same. We are trying desperately to support families and the ability for families to take care of each other and and be there when you most need it, to celebrate a new baby or to hold the hand of your parent as they pass. And it's incredibly important that I think that we, as those of us who can get real in the policy weeds, and I know we all can, because that's why we're here, to zoom up and say it's a bigger value set. And until we shift and start talking about it that way, that's how you get to a kind of European model of how do we have a care infrastructure. And I think it's so very important to talk about it that way in our communities, because that gets us to a point of problem solving that is not partisan, but about talking about our values. And in this case, it's about making sure that people can take the leave they need to take care of their family members and themselves. Right. And have the support they need when they're sick.
Yeah. And I think just because we can't get through one of these panels without having this part of the conversation. So right now, the United States of America does not guarantee paid leave. We don't guarantee 1 day. We don't guarantee $1, whether it's because you're sick, somebody you love is sick, you're welcoming a new child. And that puts us wildly out of step with the entire rest of the world. So compared to all other OECD countries, we are one of only 2 that doesn't guarantee paid leave for workers on medical leave. And when you talk about for welcoming a new child, in 2014, the International Labor Organization did a big study of every country in the world, in which they found that there were 2 countries that don't guarantee paid maternity leave. Those countries are Papua New Guinea and the United States of America. We're the richest country in the history of the world. And we're not showing up for our families. We're not showing up for our people. Mm-hmm. We're not doing the things we need to do to take care of ourselves, to take care of our families, to take care of brand new babies when we know how to do it. And I think the thing that we really need to think about here is it's not just that we absolutely can't afford to provide this benefit. It's that we can't afford not to. Our economy is leaving $22 billion a year in lost wages alone on the table from failing to guarantee paid leave. And that's before we even start to look at the health impacts. That's before we start to look at the economic growth impacts. That's before we really start to understand all of the ways in which this is the investment we need in the future we deserve.
Can you talk a little bit more about that, what we're leaving on the table, that like where that money comes from?
It's a Center for American Progress study, but not mine. So Center for American Progress Research in 2020 found that each year we lose about $22.6 billion in lost wages from lack of paid leave. And where that comes from primarily is decreases in labor force participation. So what we know from lots and lots of research is that when workers are able to take the time they need and then come back to work, instead of getting pushed out of the labor force entirely, either temporarily or permanently, that means they are working more, they are earning more over the course of their lifetimes. So for example, we know that when new moms are able to take paid leave following the birth of a child, they're more likely to be working a year down the road, they're more likely to return to the same job, and they're earning more. And they're earning more in a way that compounds over the course of their lifetime. Similarly, when caregivers are able to take the leave they need to go and care for a loved one instead of getting pushed out of the labor force entirely, which happens to people across the country each and every day. That means they're able to keep working, they're able to keep earning, they're earning more, and our economy as a whole is benefiting in ways that I think we're only really beginning to understand.
Thank you.
Well, and I would add to that too, Jay. Sorry. Just quickly. I mean, we haven't even talked about the gender gap around this, and Molly touched on it a little bit, but just the idea of participation in the labor force for women, and what it does to take time out, and whether you can come back and fully participate after having a child, or if you've been, having a child is an economic setback that compounds over your lifetime. That has, as we all know, real implications to the gender gap and the wealth gap for women and children. And so it's another, another big policy arena. Again, we could have another Zoom on that, obviously. But it's just, I just wanted to flag it because she mentioned it in passing that is a huge issue for women over their lifetimes.
Do you want to talk a little bit, and Josh, we'll get in just a second, but talk about how the gap would improve with paid family and medical leave?
Sure. I mean, Molly, I'm sure that you all have done studies. Center for American Progress has all the data on all of this because that's what I relied on when I was a lawmaker. So, but just the idea of as your pay increases, as you pay into Social Security, as you pay into retirement, as you build wealth over time. And the ability to earn and learn and do all of the things that we know stabilize your ability to make money in this country and to have wealth and to build an economic life. When you are or pushed out of that, you suffer. And so there are real economic downfalls for women when they don't have the support they need, whether to have a child or with childcare and to fully participate in the workforce. And so, Molly may have a much deeper dive policy and numbers wise on that, but it just, this is just another compounding part of not supporting families that ends up disproportionately impacting women in our economy.
So to follow up, I think just on one piece of that's always useful to highlight, is thinking about the relationship between paid leave and retirement security. Yeah. So women are at a big disadvantage in saving for retirement. They're at a big disadvantage in accumulating Social Security benefits. Women actually rely on Social Security benefits more, but get less. And all of that is even more so true for women of color, particularly Black women. But what we know is that when women have access to paid leave, they can stay in the labor force, they can earn more. That means they're racking up higher Social Security benefits. They have more opportunities to save for retirement privately. It also means that if you're in a family crisis where somebody has to stop working for a while, for a lot of families, what happens is you tap those retirement savings. Mm-hmm. Like mom's 401k turns into the family's paid leave program because somebody's got to be there to provide that care in a crisis. And so what we're doing right now is we're paying for our lack of paid leave really inefficiently. Families are suffering, the economy is suffering, children are suffering, and employers are suffering because we're doing this in this really inefficient way. We're all scrambling to put it together ourselves. Whereas if we pay for it smart, we can reap all of these health benefits, reap all of these economic benefits. And at the same time, by the way, to speak to our values, we can take care of ourselves and our families in the ways we all believe in.
I find that aspect of it so interesting. So thank you for shedding some more light on that. And I think it's an interesting segue because you talk about care of others. And so I think one thing I mentioned earlier was the sandwich generation. It's talked more and more recently in recent years. And so adults between 40 and 55 are often in this place where they're raising their own kids while also having to take care of their aging parents and grandparents. What are your thoughts on how paid family and medical leave programs could improve the quality of life and medical outcomes across multiple generations like that? Josh, do you want to start off with that?
Sure. Yeah. So one of the things we think about a lot is family stability and the benefit that brings. So most families, they're working full time, they're working hard, but they're also juggling these other responsibilities, kids, parents. And you can have sort of a big, what we call exogenous shock. Something happens where you're not able to earn as much as you can. And that can put major pressures on family. It's a lot of stress, a lot of burden on marriages. So one way to help relieve that stress is to take away the fear that you're going to lose a bunch of income because grandma's not doing so well, or the birth of a new child that should be really happy time in your life. So paid family leave provides that income stability that we think helps buttress family stability in these cases.
I would add too, JD, especially in rural communities where there is a lack of healthcare and senior supports, the ability to take time and be the person or that, that the people who are taking care of your loved one. Like I said earlier, my entire family, we're farmers. There's 6 kids in my family. My father passed away 2 years ago, and we were able to take time to be with him, which was essential, not just from an emotional perspective. We couldn't find nursing care. There was no nursing care available in that community to give him the care he needed to stay home and hospice and pass away with the loved ones around him. And so it was really, the bottom line is he wouldn't have gotten care at home, and he would have gone into some sort of facility, which, as we all know, is incredibly expensive. And so the ability, especially in rural communities, to be able to provide that care is essential, because the care will happen in a more expensive environment for everyone involved, including the system, or it won't happen at all. And then we have our seniors being uncared for in this country. And so I think it's really important to put this focus back on our rural communities where there's such a lack of care infrastructure, whether it's senior care, hospice care, new baby care, child care. We just don't have that infrastructure in our rural communities. And so it is, as Josh said, when you have some sort of shock to the system as far as an illness or something like that, it can really impact you economically. But for the whole, things just are more expensive when you do it in a way that's not thoughtful.
And I think to really build on, and I think to a theme of this whole summit, we know that rural healthcare is in crisis. We know that it's extremely difficult to access care. We know hospitals are shutting down. And for families, what that translates into is New America did a study a couple of years ago where they compared rural to urban census tracts. And they found that folks in rural areas have to travel 3 times as far for cancer care, 4 times as far for cardiac care, and 5 times as far to reach a NICU. And when you don't have the paid leave that you need, just the time it takes to get to that place of care becomes a prohibitive barrier to getting the healthcare that could change your life or save your life. And I think if we think about rural America, also just thinking really practically about how this plays out. So I am from a small town in central Kentucky, and where I'm from, like in a lot of rural areas, the only way to get places is to drive. And if you physically can't drive yourself, whether that's because of your age, whether that's because you're too woozy after chemo to drive yourself, whether that's because, to go to another topic, if the reason you need paid leave and you need care is because you're getting treatment for substance use disorders, let's say you've lost your license because of your past substance use, but now you are working to get the care and treatment you need. In a lot of rural America, if you can't drive yourself, the only way for you to get to that care is for somebody who loves you to drive you. That's your mom, that's your husband, that's your sister, is taking the time out of their day to get you there. And if that person doesn't have the paid leave they need to support you, you're not getting the care you need. And as we're working to fix all of these different problems and to respond to all of these different systems, I think really ensuring that communities have paid leave is an investment in the ability of all of our communities to care for ourselves in the ways that we want to and in the ways that really live up to our values.
So we talked a lot about care. Here in Iowa, we have an OBGYN crisis. And we're not necessarily even talking like pure rural. We're talking like towns of 5,000 people not having to travel an hour just to get care. Have we seen this in states that have passed paid family and medical leave, that it's it's the infrastructure for the care has improved, or is that like totally separated? Because I think that's something like I'm really intrigued to see how that overlaps. Does anybody want to?
I mean,
Yeah.
I think two things we've seen. One is just as we think about the broader problem of healthcare in this country, particularly rural healthcare, is healthcare workers also need paid leave, and an awful lot of them don't have it. And so if we are ensuring paid leave for all workers, including folks like home care workers, folks like nurses, that's an investment in having the kind of workforce we need. Similarly, if we're thinking about childcare, ensuring that folks who are providing childcare have the paid leave they need for themselves and their families is an investment in having the workforce we need, and it's an investment that pays off. I think the other thing is that we've certainly seen increases in access to care, and we've seen the health outcomes that go along with that. So we have pretty good research around moms and babies, and we know that when folks have access to paid leave, we see benefits in infant brain development. We see children are more likely to get their vaccines on time, they go to their well visits, better language development, fewer behavior problems. We see reduction in preterm births and lower birth weights, which have really significant health impacts because people are able to take the time they need to get the care that they need, to get the rest that they need, in ways that really pay off in health for all of us.
I know that we all want to put the pandemic out of our minds, but not that long ago, we really needed people to stay home and take care of themselves when they were sick. And in fact, we still do, right? We still have COVID issues in this country. But the idea of, and this goes hand in hand with paid sick leave, right? The ability for people to stay home when they're sick and have someone there to take care of them is a public health good. And we haven't heard that phrase yet today in this panel. But again, thinking about the 30,000 foot view of this, like we need as a community for people to be able to stay home when they're sick. And it really, like as Molly said, I mean, healthcare workers are also workers, and they get sick. And we particularly need healthcare workers to be able to stay home when they're sick and be cared for. And so, having paid sick leave in addition to paid family leave is really important for our care, our care infrastructure, but our healthcare infrastructure as well, to make sure that folks can afford to stay home. And that they have the care that they need as well. I don't know, JD, if we've seen the correlation between the increase in availability of care yet, especially we just got through a big fight about an OBGYN center in the Columbia Willamette Valley closing in a rural-ish community, but a community of color in particular. And so I don't know if we're going to see that as a benefit. I hope we do. We haven't had the program on long enough to have, to look at those correlations, but that those are such complicated systems that have so many levers, right, in the availability of care in rural Oregon. But I think it goes back to the need to have options when you're sick or a loved one's sick, even though these larger conversations about whether or not there are OBGYNs available, there is one if you can get, as Molly said, in a car and drive to one. And so as an individual, my ability to get the care that I need or to make sure that a loved one gets the care that they need, regardless of what's happening in the larger American healthcare system, God bless it, we need to be making sure that people can get the care they need while we work on these kind of large behemoth questions of policy in this country. It trickles down to individual families. And so, paid family medical leave is a foundational policy that other progressive policies can be built upon or are impacted by. And I want to make sure that we really emphasize that as well, that all of these other things don't work as well if you don't have paid family medical leave. And so I don't think we can state that enough, or emphasize the need for this policy as a foundational policy, kind of regardless of what's going on in the rest of our healthcare system.
And I'll add, there's issues of access to health centers and childcare in rural areas, but one of the things that's always around is family members, right? So be it those family members, the time they need and the support they need to take care of kids, take care of parents. I think that's number one, and that's especially important in community places.
Jennifer, I had a question. You mentioned earlier the insurance industry was one of the groups that were against or just trying to get their way into it.
They were involved.
Yeah, right.
I won't say against. I will say very involved. No, you're fine.
my binary mind. What I guess, as somebody who wants to do this in Iowa, what groups were surprising me for this, or anything like that?
Yeah, I think JD, you hit the nail on the head by saying binary, because it's not a binary conversation, and I think it can be cast that way, right? I mean, like I said, we had a huge table of folks negotiating this policy. It was one of the things that made it really difficult, frankly, is everybody has an opinion and everybody wants to be involved and everybody has skin in the game, right? And so I jokingly said the insurance company showed up, and of course they did, right? That, the idea of if you're gonna have a solution in a state that involves buying insurance policies, they want to be there to talk about what that looks like, right? And I don't fault them for that. Right. But, so they were there talking about, like, we have the ability to provide some of this care. As a lawmaker at the time and a policymaker, it didn't align with the values I had going into the conversation. So, like I said, I don't fault them for being there, but I wanted a different outcome in the policy I was trying to pass. I do think that we think very in a very binary way about employers when it comes to this conversation. I would say that's the one flag that I have, is that I started out by saying I am now a small business owner. And so, I'm an employer, and people talk a lot about, like, how employers feel about this, or, and like I said, I don't want to have to buy an insurance product to take care of my employees, frankly. I would love universal health care too, for the same reason, selfishly, as an employer. And so the idea of employers want this, and so we're going to have to exempt small employers because big that's just not the case. And so making sure that there's a real variety of employers around the table talking about what they can do, and what, talking about intermittent leave and how that impacts a small family business that, makes furniture and has 10 people that work there, and 5 of them are experts. What do you do when those folks start taking leave? And we had real hard conversations about what leave looks like and the kind of impact it has on an employer, especially small employers, because it can leave you without a key employee to run your business. And so I think that's the piece that I really learned a lot about as a policymaker, because I came in having real black and white views about what employers liked and didn't like. And I was completely taken aback by the nuance of that conversation and the number of employers who want to do the right thing. They want to take care of their people. They want their people to be healthy and happy, and their families to be healthy, because it helps their bottom line. And that most people are good people, and so they want their communities to thrive. And so I think that was the conversation that to me was most interesting and most nuanced. And I don't know that I expected it, because often you hear from big employer associations, and they come in as one big voice, and it's like, this is what we're doing, and you can't do this to employers. It's going to ruin the economy. And when you start talking to individual employers about what they want and what they need and what they think will help their communities thrive, it can often be very different.
To also emphasize on top of that, small business owners need paid leave for themselves.
Yes,
and mostly don't.
Also that.
And
Yes.
I think that's a
Thank
piece
you,
that
Molly.
I think I 100% agree with those. But I think really when we think about what happens when we don't invest in paid leave, is that small business owners who have no employees, who have very few employees, are literally working themselves on days when they should be recovering from surgery because they cannot afford to take the time that they need to take. And that's a cost that as a country we are putting on them by failing to make that investment. And I think that's true for all different kinds of small businesses. We've seen a lot of self-employed folks and small businesses talk about this, but to lift up one example, particularly for this context, one of the largest populations of self-employed people in this country is still farmers. It's still family farms that cannot afford to have. But if we invest in a paid leave system, what we're saying is, okay, here's money coming to you that you can use to pay your bills. You're not relying on your business's income for your bills anymore, so you can make the smart choices for your business to cover this gap in a way that lets you and your family get what you need.
And yeah, and to Molly's point, I think it goes back to the big associations who often get involved in these conversations in our state capitals and in our nation's capital, as opposed to the individual members of those associations. Because when you talk about big farm associations, it's often mega farms or big business associations. And so it's really important to get people who are actually impacted at the table, helping to set these policies, and not necessarily the folks who show up day to day in the state capitol.
I won't get into it too much, but I'm like, are you trying to say that the agriculture folks up here aren't listening to the farmers, or they're disconnected?
I don't know what you're talking about, JD. That's weird.
Yeah. So, well, that's for another discussion. No, as we wrap up here, I guess I have two questions. I'll go around. Josh, I'll start with you. First, I want to know what gives you hope in this, in all this, and secondly, where can people follow up or find you and your work?
Yeah, I'm given hope by the increasingly bipartisan interest in this. There's that groundswell of popular support. It's just a matter of getting folks to the table and finding the type of programs that work best for them and growing it from there. If you want to learn more about our work, you can go to Niskanen.org, where we have lots of good stuff on paid leave. In about 3 months, we'll have some more. Our paid leave analyst is going out on paid leave.
Excellent.
But be on the lookout for more from us.
That's very cool. All right, Molly, do you want to go next?
I mean, the thing that I think really motivates me in all of this is paid leave saves lives. We have the research that shows paid leave reduces infant mortality. We have the research showing that when folks don't have the kind of paid leave they need, they put off or don't get the kind of healthcare they need that could save their life, but paid leave allows them to do that. And I think when we think about the stakes of this work, that's the part that really matters. That's the part that we can't get back, and that I think folks really understand and are working towards. You can find out more about our work at AmericanProgress.org, or if you're interested in getting more involved in the national movement, PaidLeaveForAll.org is the coalition.
Can you talk about the coalition just briefly?
So Paid Leave for All is the national coalition working to enact paid leave federally, bringing together advocates, policy experts, labor leaders, small business leaders, folks from around the country working to pass paid leave, and working with a number of state coalitions that are working in states around the country. But Paid Leave for All is the federal coalition.
Thank you. And Jennifer?
Sure. What gives me hope is, like I said earlier, polling. Every time I see a poll on this, I am excited about Americans knowing what they need to be successful. And every time I've helped someone here fill out their application for paid family leave. I mentored a young woman from the age of 8 to 18, and she just had her first baby. She's in her early 20s, and helping her fill out her application for paid family leave was incredible. So every time somebody calls me and says, "How do I do this? What's this law again?" I am given hope. You can find me at swiftpublicaffairs.com. And in Oregon, our Family Forward Oregon is the organization that I worked with in the legislature. I still work with, and is our coalition partner for Paid Leave for All. And they are fantastic folks. And you can find them online, or you can reach out to me and I can connect you.
So here's a hypothetical. If I were to be door knocking tonight, what scenario should I bring up paid family leave?
I was going to say, as someone who door knocked and talked about this a lot.
Sorry.
No, you're fine. You're fine. I don't want to jump on everybody's toes, but boy, did I door knock over 10 years. You know what, JD, the question is, what do your communities need? And what do they need to be successful? And it's part of a whole conversation. And this, like I said, is a base to build on all of the other policies that you want to talk about, right? Like, people want to have a great education system and a great healthcare system and a thriving economy. In order to do all of those things, we have to take care of our families, and paid family leave is a huge part of that. And so I think anybody talking about economic policies, particularly if they were out talking to voters or community members or having a town hall, or, you know, anytime anybody will listen to you, I think if we want a thriving economy in this country, we need to have paid family medical leave. And that's how I would talk. I would talk to community members about why this is so very important, and give a story or ask them, because everybody's got a story about when paid family medical leave did make the difference or would have made the difference in their lives.
I think that's great. Well, thank you so much. We have 2 more minutes, so I jumped the gun a little bit. I guess, when you door knocked, did you have any negative impact when you talked about family leave?
No, I think people just don't understand it.
Yeah.
They think it's another thing that will be expensive, that will somehow, their employers can't afford it. And so I think it's educating, right?
Yeah.
It's educating folks on why this is so fundamentally important, why it costs our country and our community so much to not have it. So I think it is the rare person who, once they get talking about the impact on their lives and their ability to take care of themselves and their loved ones, and why it just makes economic sense for our communities, especially our rural communities, that people get on board. They just don't know. They think they have to live in a society where they have to make choices, and they have to make choices between having a job and taking care of a loved one. And we live in a country where we make people make that choice, and that is unconscionable, I believe, and expensive. If you want to get down to brass tacks. And so I think, people, if they oppose it because they don't understand it, or because it's just so foreign to the way we think about our economics in this country. We don't think about taking care of ourselves and our families and our communities as an economic benefit. And we need to change that conversation.
Absolutely. Well, thank you so much. This was a terrific discussion. Jennifer, Molly, Josh, I feel like we barely even scratched the surface on this topic, and we can continue to go down. But thank you all for what you're doing. To learn more about our speakers and their work, you can visit their bios in the Summit virtual lobby, and visit onecountryproject.com to follow our work supporting paid family and medical leave policy. Now I'll turn the summit back over to Heidi as she discusses federal paid leave policy with Senator Angus King and Senator Deb Fischer. A reminder to our viewers on Zoom, please return to the lobby and select featured conversation with the folks I mentioned. It should be in the list of sessions. And then for our viewers on Facebook, the stream will resume in a new post momentarily. So with that, thank you all for joining and for this discussion.